When I first started this semester of evidence-based practice, I was very lost. I felt like Dorothy looking for Kansas in the land of Oz, not knowing any idea where I was or how I got there or what was going on. But I have been able to develop a lot of skills to be able to help me with my evidence-based practice. So first, I learned how to use different databases. This was very essential to me because I had only ever used PubMed. I used to Google stuff on regular Google, not Google Scholar, and hope that I could find it. So that was big for me to be able to use things like CINAHL or other databases to access the information. I also learned how to search for the specific evidence I wanted. I did not realize that how to create search terms or mesh terms or any of that in order to search for the specific terms I wanted. I thought you just kind of put in your topic and got lucky of what you could find. Along those lines, I also learned how to understand what how to look for the research. I before was never really taught that you had to look for certain things like the population or what sports or activities the research was being conducted on in order to ensure that the research was relevant to what you were looking for. So I thought that was a key thing in my learning. I also learned the importance of implementing EMB into the practice. I kind of just thought, oh, since my preceptors did it, or since Chad Starkey said it in his book, that this test had certain sensitivity and specificity, that would be a good test to use. But now I realize that I am responsible for going out and doing my own research and understanding that it is on me. It isn't my preceptors. It isn't what I was taught before, because medicine is always changing. So there might be a test out there that is a lot more reliable than the one I know, and I am responsible to go and find it. I also learned better how to use SORT and Oxford scoring to score the evidence of the quality of evidence that I'm looking at. I've heard of it. I've read it in research articles, but I've never actually understood how to do it, and it's been really confusing to me. So this semester has really helped me understand what's going on with that, and very baseline. I still need to work on scoring the documents. And I also learned how to implement evidence-based practice into my patient-centered care. I think that at first I thought this was crazy. I thought they were two separate things, because if I'm telling I did not understand how to instruct the patient on the best evidence practices while still giving them a choice to be able to choose what they wanted to do with their treatment. But I think I'm getting better about understanding how to give the information to the patient about the evidence while still not forcing forcing a certain treatment. Through this semester, I've gained courage, like the lion from The Wizard of Oz, and by developing the definition of evidence-based practice. And my definition is that it means to assess the reliability of certain treatments and ideas. I think that this gives me courage to go out and look for this evidence and pull it out, and then that gives me courage and understanding that what I'm doing is reliable, or if it isn't, that I need to go and have more courage to go and look for a different treatment. The backing of the information with research really helps me to know that I am giving my patient the best care that I possibly can. But like the scarecrow, my brain is still going, always going, and continuing to develop questions. So the first question I have is why someone would go through all this research, all this time to write this huge article, and then not make it accessible to everybody. I just feel like that if I did all this research and worked really hard on this project, I would want everybody to know, anybody who this could benefit to know. But I just don't understand why some articles you have to pay like $30 or $40 to actually access. Another question I have is, how can I use my data that I'm collecting and recording to help better the profession? We talked a little bit in Dr. Powden's class about using EMRs and putting that into a larger database and that being collected. But I would really like to help with that, because I understand that like I'm not doing my job and treating my patients to collect the data, but data is always being presented to us. So I feel like when a patient comes in and that data is collected, might as well put it to use, and I can treat the patient, help them with the data that has already been collected, and put that data into something else to further the care, so they're helping the people in the future. Like the Tin Man, I had armor, and one of my biggest challenges this semester in this class and all the classes was shutting the world out and just wanting to like get my classes done. And I realized pretty quickly that that was not a good thing, and that I needed to like actually go and spend time doing other stuff besides my classes. I when you first said that to score stuff using sort in Oxford, I instantly put my armor on and was like, I don't really want to do this. I've never understood it. I've tried to understand it. I've tried to learn it on my own multiple times and just didn't understand it. But I think that like calming down and using it in the context of the Excel sheet really helped me. I think that I overthought a lot in this class, and that made it more difficult for me because I ended up redoing assignments a lot to try. I would read the assignment one time, get halfway through it, and be like, this isn't what was being asked, and then change basically the entire assignment. So I think that if I stop overthinking stuff and just do exactly what the assignment is telling me and not try to look deeper or anything into the questions, that my life will be made a lot easier. But I also found my heart during this semester. I was proud of learning how to read the research. I've always liked reading research, but I never really understood how to effectively read it. So the 5 steps that you presented to us was really helpful. And especially I've noticed the different highlighter colors. That really helps me organize how I read the articles, so I can pull out definitions, I can pull out the main purpose of the article, the data that the data that backed up that purpose, and then how the author concludes the article with that data. So I think that has really helped me a lot, not only in my evidence-based practice, but just as like I'm reading about like surgical techniques or something that it interests me. I also found that I liked writing about our PICO question. I think that scientific writing is really important, and I would like to get better at it, just so I am able to understand how to read it better. I know that I have a long way to go to Oz, but I think that this class has helped me develop the skills I need and has led me to the Yellow Brick Road. I know how to research the selective tissue tests that I am using and currently using, and how to understand if they are reliable or not. And even further, if they're not reliable, I know how now to go and find a more reliable one that might be better for my patients and the population I'm working with. The research techniques have been a huge help for me. I think that I've noticed after taking this class and learning skills in this class, I was able to go to my other classes and know exactly how to get research for them. And that has really helped me spend a lot less time just going through Google or going through those 1,800 documents that have been found that aren't even, to just find like 3 that are relevant to what I want. So I think that was really helpful to me. Most important, I just would like to read more, and I expose myself to more literature. This class presented to me that it is very important to just keep exposing yourself to everything, because the medical field is constantly changing and constantly progressing, and we need to continue to progress along with it. My goal after giving the evidence-based practice like presentation and trying to develop that is that I would like to get better at giving presentations in front of groups. I set the goal of speaking at NATA one day, because right now I am not very confident in presenting in front of groups, but I think if I can do that, it will help me realize that I can help the profession out and present to people alike to me, and present the information that I have found or ideas that I have found. And if I can do that, I will be better able to talk to my patients and give them information and learn how to give the information in a way that they can understand it. So I think that this class has been really effective for me, and has helped me in my journey to Oz and understanding how to fully understanding the profession of athletic training.